Hi. Nice to see such a big, massive crowd in Limerick.
Hey!
I'm an activist with the Stand Up for Mental Health campaign in Limerick. We initiated this campaign about 10 months ago in response to a spiralling mental health crisis in Limerick, which is a black spot for mental illness and suicide. We're campaigning for a proven mental health programme to be implemented into all schools and a 24-hour on-call crisis counsellor who could operate from a designated crisis centre for Limerick. And in more general terms, we're calling for a reinstatement of funding to mental health services. At the moment, only 6% of the health budget is spent on mental health, only half of what Britain spend. Services are starved and barely functioning and have a massive rate of dissatisfaction amongst the staff and patients alike. But I want to focus on services at UHL. Somebody presently in a mental health crisis currently has to present themselves at the A&E department. This in itself is barbaric. To send someone so vulnerable into what has been described as a battleground is inhumane and should not be accepted. Patients have to wait long periods to get assessed and then they are either released or sent to the mental health facility in Ennis, if there is space there. The suicide patrols, who report at least one intervention a week, say they are meeting these people again and again an hour after their release back down at Rivers. Limerick City not only has twice the national average rate of suicide but has the highest rate of adolescent self-harm. Not only was the after-hours children and adolescent mental health services cut at UHL, but there are currently absolutely no adolescent acute mental health beds in the Midwest. We've heard the horror of kids going into adult wards. We want a designated mental health crisis centre which would alleviate crowding at UHL and could serve mental health patients more effectively and with dignity. We have to understand why this is happening. Why there is no political will by Fine Gael, Fianna Fáil and Labour before them to address the health crisis. I believe there's an agenda to privatise, and a skeletal health service will drive this agenda by forcing people into private health care. This is why it's predominantly a working class issue. Not only are Fianna Fáil and Fine Gael, their neoliberal policies driving the mental health crisis, but people are then dying because of the lack of services. We need a mass people-powered movement like we saw with the water charges to fight back, because enough is enough.
Next we have Damian O'Donoghue from Tipperary. He's the spokesperson for the Nenagh Needs A&E group.
On Damian! It's too tall.
Bit of a height difference between myself and Seónaidh. Okay, so first off, first off, I just want to thank each and every one of you who is here today to support the fight for decent healthcare in the Midwest. I'm very proud to see such a big crowd, and I'm delighted to see so many from Tipperary here as well. So thank you to each and every one of you for your support. I just briefly want to mention some of the political figures in Tipperary who supported the campaign: Sandra Farrell, Seamus Healy, Joe Hannigan and Martin Brown.
Hey!
I'll be brief. My name is Damian O'Donoghue and I'm from Nenagh. On the 6th of April 2009, Nenagh had its 24-hour A&E services cut with a view to creating a centre of excellence in Limerick. Well, I was in there recently, and I don't need to tell you this, but that is no centre of excellence.
Yay!
We were lied to. In Nenagh, just like in Clare and Limerick, we want a restoration of our 24-hour emergency department. Now, this is obviously not as simple as hiring somebody to work a night shift. It requires the upgrading of our hospitals, the reinstatement of our cardiac unit, and the reopening of our intensive care units and more. The hospital has to be built around the A&E.
Yes! Yes!
Now, late last year, there were 4 people from North Tipperary along with their family members waiting to be seen in Limerick Hospital. They sat in a corner of the waiting room. They were talking to each other, they were trying to pass the time until 2 of them left after a 9-hour wait. And this scenario is commonplace, and people from Clare, people from Limerick and people from Tipperary see this happening every single day. And the Mallow man here in front of me as well. People from Mallow too. My grandparents have languished on trolleys for various, for days at various times over the last few years. They were vulnerable, they were exhausted, and they, like everyone else, they did not deserve that. Limerick cannot cope. 70, 80, 90 people on trolleys, huge waiting times before people are seen. You have to wonder, when will enough be enough? And remember, if one person is on a trolley, the hospital is over capacity. Now, I know people have called for answers in this area. I know Maurice Quinlivan has mentioned it all, and Mary Catlin has done sterling work over the last few months leading this campaign, asking questions and not receiving any answers. I also want to mention the staff. So we've spoken to many of them. They are experiencing some of the worst working conditions imaginable, and these conditions are unsustainable, and these conditions are unfair. So look, I think my main point here is this, and it's the reason we're all here. This is not right, and this is not acceptable. So let me send a message from the people of Tipperary, from the Midwestern campaign, from the 10,000 people who've signed our petition, and from everyone that's here now. We are united in our fight, and we will keep coming back until the powers that be listen to us. Look, we're not here for the crack, we're here for the future of our communities, we're here for our children, we're here for our grandchildren. I have an 8-year-old daughter, I'm here for her, and that's why we're all here, it's for the future. So as we stand here on the first day of spring in the old calendar, I believe this is the start of something new, and I believe this can be done. So I'm going to finish on this. As Tanya said in our very first meeting in Nenagh last year, and I want everyone to remember this, the power in the people is greater than the people in power. Go ahead,